is Vice President of Population Health at Henry Ford Jackson Hospital, Dr. Courtland Keteyian. Courtland, welcome back to the show.
Thank you.
Here we are, just over 2 years.
That's right.
Into this pandemic.
Yep, 2 short years.
Yes.
Two long years.
2 long years, yep. And it's not over.
No, so I think we're in a much better place than we were, obviously, definitely. But it's not gone. It's definitely not gone. You got those numbers from the health department, so we still have cases that are kicking around Jackson. Mm-hmm. Just kind of for comparison, when we were, really, really at our peak, which was January of this year, there was over 8,000 active cases in the county, so that we knew about. So I mean, really kind of a staggering number. And right now, the health department, if you do the math on those numbers, it's 200 to 300 in a given week. So I mean, we're orders of magnitude fewer cases now than we had then. We're still undercounting because those are the tests that people get that are reported to the state. The home tests, people do at home. Those don't register. But definitely a much better place than we were. The hospital is. There's 8 people in the hospital right now with COVID-related illnesses. Nobody on a ventilator, so that's better than we've been in a really long time.
So who's being hospitalized now? What's the population that is still going in and having to be treated there?
Yeah, people that are unvaccinated. That's been the case all along, and even more so now. But yeah, at this point, it's unvaccinated. It's people that have sort of more complicated medical problems, right? That have gotten it, or are elderly. Age is kind of the single most important predictor of a bad outcome or needing a hospitalization. So that's who's there now. But we're keeping our eye on it because we know that there's other places in the country that are seeing more cases, or other parts of the world that are seeing more cases. So we're definitely being aware so we can be prepared.
Yeah, so we're seeing in Europe cases are once again going up. New variant, BA2. Mm-hmm. That is the predominant variant now in Europe.
Yeah, and so the BA2 is actually it's a subvariant. It's Omicron, but it's a sort of a child of Omicron. It's the lineage of the Omicron variant, and so that's a very easily to spread, very transmissible variant. That's one that's driving most of the case increase right now in the UK. It seems to be driving most of the case increase we see in New York. New York's got about a 60% increase in cases over the past 2 weeks, so everybody's kind of got their eye there because New York seems to be kind of a leading indicator for the rest of the country when we see another surge. There's actually another variant that is actually a combination of the BA1 and the BA2. It's called XE. That's also circulating in the UK right now. So there's a lot of attention on that as well. But again, it's still these are all Omicron family variants or lineage. But we still need to be aware of it because I think what's going to happen is we're going to see that we had our biggest surge happened in this country December, January, and either a lot of folks were already vaccinated or they got it. And so we have this window of very high herd immunity. We know that both from studies now done on the vaccines and from studies done on people that have been infected, that immunity tends to last somewhere in the 4 to 6 month range. And I'm talking about antibody levels, right? And so we will see people get infected again, and we've seen that now. It's people that had Delta and then got Omicron, or had other variants earlier on and got a new one. So we're now seeing people get infected more than once.
Well, that's good, because I actually saw on the Henry Ford Health website this morning the figure 43% mm-hmm. of the population in the United States has had COVID. Yeah, that's astounding.
Yeah, and that's probably an underestimate, honestly. But yeah, it's a huge number. It's a huge number, and like I said, in a lot of ways that can be good because it does help provide some of that herd immunity, but we know that there's a limit on how long that is going to last at this point.
And that's where the vaccine comes in, the immunity from having COVID versus the protection you get from the vaccine. Mm-hmm. Are they comparable?
That's a good question. I would say roughly yes. It depends on the variant, and so getting one variant, getting a variant, you're going to be relatively immune to that variant for that period of time. The vaccine tends to give a little bit more broad immunity, so you would have better immunity to the different variants. But what we tend to see is that it's one variant that's dominant for a period of months, and then it tends to switch. And so I think you could debate what's better. I think the issue is that the risk of getting COVID versus the risk of getting the vaccine is completely different. So people who say, well, I'll get it and then I'll be immune. One, there's the risk of what happens to you when you get it, and two is that you're still going to have it's not going to last forever. And we know that now for a fact. Once you get it, you're not immune for the rest of your life. This is something you're going to be dealing with again. And we're going to see this continue to circulate. So I think the idea that this just kind of goes away has pretty much been accepted. That's not the case, that we're going to continue to live with COVID for a very long time.
I was talking to an emergency physician this morning, and he said he's seen just one COVID case in the last 3 weeks. Based on that and what we are seeing with Europe and the history where U.S. has followed Europe with a spike in cases, are we letting our guard down too soon?
I've enjoyed the last few weeks, like going to restaurants again and things like that, because this really is, I think, a window that we have here. I think though we do still need to be, we need to be aware and be prepared that we might have to, go back to, wearing masks and washing hands and doing things that we know work really well. So I don't know that, we've kind of let our guard down now, but I think that we have to continue to be prepared for what could happen, and be willing to, take steps again if we see that it's getting out of hand. My hope is that we're not going to see the same level of spike, and I think we've seen that in Europe too, or they're not getting the same number of cases that they did before, because there is still some immunity. And so hopefully that's the case now here too. It is very important, and I think this is brand new, is that second booster dose. A lot of people have just had the primary series, had the primary 2 doses, and have said, okay, I'm good, or they've had their third dose, which is the booster. For those 15 over, that population that's particularly susceptible, really important now to be having that conversation with your doctor and getting in for that 4th dose. It's been used in Israel, other parts of the world, and it's been very effective. And so really no reason not to go be doing that at this point.
Yeah, so the FDA, CDC, both last week along with MDHHS, get the 4th shot or the second booster, both Moderna and Pfizer, right, have the booster?
Yep, both mRNA. Yep.
How many months after your last booster should you, if you're 50 over?
4 months. Okay. Yeah, so the series is for the Pfizer and the Moderna is basically get your first shot, you wait either 3 or 4 weeks depending on the brand, then get your second shot, and that's your primary series. And then you should get a booster at 5 months, and then another at 4 months is what the current recommendations are. It's been very effective. And again, I think it's important for people to understand that it's not just trying to prevent illness. I think the viruses are so contagious that they do often still prevent or cause illness in people who've been vaccinated, but they are excellent at preventing the really bad outcomes, keeping people out of the hospital, off ventilators. The vaccines are just spectacular at preventing those outcomes. So people may be vaccinated and still get the sniffles, but I'd rather have the sniffles than be hospitalized for weeks. So
now the vaccine booster this year, you said you think we're going to be with COVID for the long run. Will we be getting vaccines every year?
Yeah, I don't think anybody knows the answer to that. I think it's hard to predict what happens with COVID. At this point, it would sort of be surprising if we didn't. Because if you think about other chronic infectious diseases where we are dealing with on a seasonal basis, like the flu, we have a shot every year to help manage. So I think it's likely to expect we're going to end up with like a seasonal vaccine for COVID as well.
So the things that have been, protecting us, the mask, the hand washing, some of that, I know you're recommending continue forever. Hand washing, I mean, obviously, stay clean.
Yeah.
But the masks, we're going to keep those in the hospital and healthcare settings.
I absolutely, yeah. It's really interesting how much illness we just tolerate all the time. It's like, I'm feeling run down, I have the sniffles, whatever, and it's, kind of wonder, it's like, well, why? The mask works so well. I don't think I'll ever get on an airplane again without a mask on. I just don't see a reason to do that. And in a clinical environment, I was in clinic this morning. We are all still wearing masks. There's just no reason not to. And those of us that are being exposed to a lot of folks every day, it's a really easy intervention. It's not that difficult for us to do, and we know that it's preventing us from spreading illness around to our patients and their families, and so we do it.
Yeah, I traveled all last week, and I wore the mask more in the last week than I had, in several months. But I agree, I'm probably always going to mask on an airplane. Sitting next to a total stranger who's, breathing and coughing and...
Well, now I think back, and how often I would travel on a plane and finish the trip and have some congestion or something, and now I'm like, well, I don't have to do that anymore. I can just put on a mask for an hour and avoid it. It's wonderful.
Yeah, it's 2 hours.
It's easy. It's easy to do. Yeah.
All right, state of the hospital. Still, it's a stress on healthcare workers.
Yeah.
They're still seeing patients, not as many. There are still deaths. It's still a big strain on our healthcare system. How is Henry Ford Jackson Hospital doing?
So much better than we were. It's because I think the thing people don't realize is when there's a surge of COVID, it's not just affecting the community. The people who work in the hospital live in the community, and so our employees get sick too, right? So most of them at home actually, because when we're at work, everybody's got a mask on, and so transmission virtually never happens in the healthcare environment. It's always outside, and so I shouldn't say always, but most often it's happening outside work, and so it's kind of a double whammy. We're seeing increase in demand for hospitalization, hospital services, and then we have more stress on the staffing side. We run short on doctors and nurses and other folks that are needed. So right now we're much more comfortable because not only are the cases down, we've got healthier people. Right, and so that's what we worry about when the surge is around, is that we start to see our own workforce ending up out for illness reasons, and then we see the demand go up for the hospital for those needs.
A year ago, we had virtually no flu because of the mask.
That's right. Yeah.
How do we get through this flu season?
It's pretty small numbers. There is more flu this year than there was last year, but compared to a normal flu season, it's nothing. This is a very, very light year for influenza. And same thing, the masks are, even the percentage of people that still wear masks, I think are making an impact, right? Even though the rules are gone in a lot of places. There's parts in the country where people still predominantly wear masks in public environments, and that's having a definite impact on the flu.
Yeah, I've noticed that. Well, obviously the airports and all that, but various just public gathering spots.
Oh yeah, yep, yeah, absolutely. Yeah, I think it's going to become, and it's been cultural, like in Asia for a long time. China, Southeast Asia, like people have worn masks in kind of the flu season for years, but they've dealt with worse types of flu, but they've just done it, and it has really, really clear benefits.
Yeah, I remember we've all seen those images of people in Asia just walking throughout their day-to-day life with the masks, and I think we've been told, it's because the pollution is so bad, or they're afraid of getting sick, and we're almost making fun of them.
Yeah.
But here we're all
they might have been onto something. Yeah.
They were onto something.
Yeah, that's right. Yeah, it's a cultural difference, and I think we should be asking ourselves, like, do we really need to be sick? I don't have time to be, have a fever and, in bed for a week. Like, I don't want to deal with that. So it's really easy to just take a little step and not have to deal with it.
Yeah, I agree. I don't want to be sick. We appreciate your time today and all throughout this pandemic. I know we'll be staying in touch, but hopefully we're on the way out.
It's definitely been, we're in a lot better place now than we were before when we look back over the last 2 years. So,
great. Thanks for coming in.
yeah, my pleasure. Thanks for me.
Dr.
having me. Yep.
Dr. Courtland Keteyian is Vice President of Population Health at Henry Ford Jackson Hospital. Up next